through. And just before I begin, I'd just like to thank everyone who's joining the call, the webinar today to listen and take part in the discussion, and also our fantastic speakers who've, all of whom I'm sure have seen from the biographies, all absolute experts in their field, and have given us the time to talk through their experience or their research, or how they think arts, culture, creativity can support people who are subject to the provisions of the Mental Health Act. And I'd like to thank Alex and Alex for organising the meeting, and of course Arts Health and Arts and Health South West for supporting the APPG and helping us hold these events. Prior to my election, I worked as a consultant psychiatrist, and so I've been very involved in terms of looking after patients who are subject to the Mental Health Act. But also, I've did a bit of research in terms of some different parts of mental health law, particularly around decision-making capacity. So this is an area which is very, very close to my heart, and I've had previous professional experience in. But I thought it'd be useful to frame just a little bit for people who are listening in what the Mental Health Act is about, what's happening from a government legislation point of view, and in particular, the reference to the arts and the proposals coming forward. So just to frame the debate this morning before bringing in our speakers. The Mental Health Act is very much about how to treat and admit people to hospital, by which that's generally detain people in hospital and treat them who are severely unwell with mental illness, to the point where essentially they can't consent or won't consent to treatment by virtue of the fact of their mental illness. It's a very powerful piece of legislation. I always say it's probably the most invasive thing that we do in medicine is to detain and treat people in hospital for mental illness. And rightly so, it is full of very important safeguards in terms of when the limits to these powers and how they can be used. It's a very important piece of legislation because quite often, sometimes when people are very, very sick with severe mental illness, so sick that they don't even realise that they're unwell, these powers are needed to bring them into hospital, to treat them, to get them better and get them back on with their lives. So very important legislation, but also one that we need to think very carefully about in terms of the scope of its powers and the provisions when doctors and nurses are making decisions for other people when they're not able to make these decisions for themselves. And every 20 years or so in the United Kingdom, we go through a big review of our mental health legislation, and we're going through one at the moment. And in the Queen's speech last week, it was announced that proposals will be brought forward this session in terms of changing and updating the Mental Health Act. This is on the back of a big review that took place a couple of years ago by Sir Simon Wesley into the operation of the Mental Health Act. And I haven't asked, but I suspect probably quite a few of our speakers probably fed into this review, and I'm sure many of the viewers probably will have. I was actually on the review myself in one of the working groups in terms of where things should go. The review has suggested that we should have some principles in terms of how the Act operates, the future Mental Health Act. And I think this makes a great deal of sense around enhancing choice and autonomy, least restriction, which in all fairness is a principle already in place in the Mental Health Act, and therapeutic benefit and the person as an individual. And certainly from my experience, I've seen on the ward I used to be a consultant on and wards I've previously worked on, just how important arts, culture and creativity are in terms of supporting people for what can be probably one of the most vulnerable, scary, difficult times of their lives, and the key role that arts has in terms of therapeutic support, but also sometimes just communicating with people or helping people on the way to recovery back out of hospital. So I'm a passionate supporter of this approach, and of course I would be, because I'm the chair of the APPG for Arts, Health and Wellbeing. And on that note, I will shut up, because you don't want to listen to me sort of bang on about it. What we really need to do is listen to our fantastic speakers who have come in to speak today, all of whom are illustrious experts in the field, have bios as long as your arm. And to save time, bearing in mind we've got so many people who are going to speak, what I'm going to do is I'm going to introduce people one at a time by name to come and speak. I won't go into the details of their background. It's on the link that you've already got, but I'll just get things kicked off in terms of starting the discussion. So we'll have our 7 speakers talk through. We'll have Baroness Lister of Bertaset and Baroness Meacher who give a response, and we've also had the chance to have some Q&A going forwards and get this discussion going. And what I hope is that this is the beginning of a conversation, beginning and continuation of a conversation in terms of how important arts, culture, creativity are, particularly for people who are so severely unwell that they're subject to the provisions of the Mental Health Act, and will drive forward continued change and improvement for people going forwards. So I'll stop there and bring in our first speaker, Dr. Lorna Collins.
Sorry, just sharing my screen. I was detained in compulsory admissions to many different psychiatric hospitals over nearly 2 decades. I had a complex, severe mental illness responding to a traumatic brain injury. During these admissions, I would lie on the floor of my room, splashing paint around the paper and the lino floor. The nurses were not too pleased about my version of interior design. But painting and writing kept me alive. Making art in the context of compulsory admissions gave me choice and autonomy. It allowed me to express both the trauma of my illness and the trauma of my detainment. My artworks illustrated my views and gave me choices. I chose to react and express. This had tremendous cathartic, therapeutic benefits. One day, I was lying on the floor of my room and the doctor said I was responding to stimuli. In other words, I had auditory, visual, and tactile hallucinations. The walls wailed to me, barbed wire throttled me. Again, detained under section. I was suffering with violent psychosis and extreme malnutrition, anorexia nervosa. I drew this detailed picture of my tactile hallucinations, a being I called Darkness Clings who strangled me. I felt throttled. Now, a doctor was passing my room. He put his head around the door, looked at me, looked at my picture, this picture, and he said, "I see you." The same doctor gave me a diagnosis of schizoaffective disorder, which is paranoia, hallucinations, mood disorder, and delusions. He gave me this diagnosis directly from looking at this picture. So my art gave me diagnosis. It then gave me the right medication and treatment immediately. Many years later, I was still unwell, but still alive. I found a hospital and treatment program in Oxford who encouraged and supported my creativity. I expressed and became a butterfly, dancing away from detainment and trauma. The butterfly became my symbol of hope and recovery, moving from the uncomfortable, cumbersome caterpillar to being locked up in the cramped, constraining cocoon, to the beautiful being with wings who can fly wherever she wishes. You'll have to excuse me, I'm a bit of a poet. Anyway, this artwork, as you can see, is an open book. I closed the book. No more mental illness, no more Mental Health Act, recovery. Now, art opens a space to communicate. It helps us convey how we feel, what we need. Creativity operates a motor which facilitates a remarkable transition towards wellness. In the context of the Mental Health Act, art making encourages and celebrates the individual distinguished from their illness. When we have the opportunity to make art, when we are surrounded by a medical team who help us process our vulnerability, then detainment and constriction become transition, experimentation, and building a new life. Thank you.
So that's me scrabbling for my unmute button. Brilliant, thanks for that, Dr. Collins. What a great way to start off the session today. David Cutler, Director of the Bearing Foundation, you're next.
Thank you very much. I was going to say, I'm the only person that isn't an illustrious expert on the call. And I feel that even more after Dr. Collins' amazing presentation, which I think just summed up a lot of what people are going to talk about. I work for the Bearing Foundation. I'd just like to give a perspective as a funder of the arts about the relationship between arts organisations that are specialising in the area of working with people with mental health problems, both in the community and also in hospitals, and give a few ideas where perhaps more work and attention could be given. The first thing that I think would be obvious to anyone is that the principles that are being consulted upon in the draft bill actually fit what we call participatory arts so perfectly, which is that concentration on co-production, on working with someone, on the perspective of the individual and their autonomy and their creativity. We believe in that at the Bearing Foundation as a human right rather than necessarily as medicine. But we also see that there is a therapeutic benefit. There'll be people who are much more expert than me on this call, but on those four principles where it talks about the research on therapeutic benefit, my understanding is that there's a lot more research regarding arts therapy itself and also on the general effects on well-being of the arts rather than this narrower perspective that I'm going to talk about, which is participatory arts with people who have mental health problems and are hospitalized. But others can talk about that. The main thing I wanted to say is there is a tremendously complex web of arts organizations that are interested in this area. We've identified 250 across the UK. There's in fact many more. Many are very specialist, either working in the community or in hospitals or both normally. A really important thing about that is they are almost always very small and very fragile, very underfunded. Of the organisations that we started funding just under 100 last year, over 50% had budgets under £100,000, a quarter had budgets under 30. So great expertise, but in organisations run on a shoestring. We're now starting to turn our attention to the underrepresentation of artists from ethnically diverse communities. And I'm delighted to see that Sandra is going to be on this call, who will be talking more about that. But you see a great imbalance, frankly, between arts organisations and the people that they're working with. And arts organisations are very, very aware of this and want to change that. And the last thing I'd like to say is we're just actually researching a publication at the moment about, which we're calling Creatively Minded and the NHS. So looking at things from the NHS organisational perspective, I'm very grateful to Stephen for producing a case study for that new publication. And you probably won't be surprised to hear that there's just huge variety between what used to be called mental health trusts, between ones that embrace it and have a high priority on it and ones with much more uneven practice. Two things I'd like to conclude with. One, a shout out for Wales. So the Arts Council Wales, I think, are doing amazing work with the NHS Confederation and have a very systematic approach, which I think we could learn from in Wales, where they're funding arts coordinators on all the regional health bodies. And the other, although we know how overstretched the NHS is, we just need to be frank and aware that the funding, when it comes to these arts organisations that are working in hospitals, virtually nothing comes from the NHS. It's either fundraised at a community level or it's fundraised through arts funders like ourselves. That might be the right way forward, but let's just pay some attention to that too. Thank you very much indeed for listening to me.
Thank you, David. And I know we've got some people who are representing, well, working in English NHS trusts. Be interesting to hear from them sort of as well, that point that you've made just about the difference between Wales and England. Next speaker is Sandra Griffiths, who's the founder and director of the Red Earth Collective. Sandra.
All right. I thought I was after Sue, but fine.
No, that's my bad. I'm trying. Sorry, it's
all right.
No, Sue Flowers next.
Okay.
Northwest champion, artist, founder, director of Green Close.
Okay.
Thank you, Ben. You've got to keep us on our toes.
Sorry.
It's a real pleasure to join you today, and I wholeheartedly welcome the principles that you mentioned earlier. Within the context of this discussion, I'd like to talk about people. People are behind the making of policies, and it's people at the end of the impact of these policies, especially when the Mental Health Act is applied. I have two close relatives with long-term, can I just check the slides are working? Yeah. I have two close relatives with long-term mental health conditions. See how precious they are here in this old photograph. One is now age 26, the other 83. They've both had episodes of psychosis, and unfortunately, one of them has been sectioned under the Mental Health Act 3 times. It's tough going when it happens, and sadly, we, like many others, experience significant failures in the system. This image, Portraits of Parity, was made in response to images held at Lancashire Archives of patients from Whittingham Asylum near Preston. At the time it was built in 1873, it was one of the largest asylums in the country. It was ultimately demolished in 2016. There's a lot of hidden and loaded meaning behind the word asylum, which is perhaps why we think of Victorian asylums as a place we would like to put firmly in the past. But the problem is the issues don't go away, and our ability to create real places of asylum, in the truest sense of the word, a place of safety for those in distress, is sadly lacking. The history of mental health care has much to teach us. So what is the role of art within this complex debate that requires us to think long and hard about safety and liberty? Using old photographs from the hospital archives became a way of inviting people into the narrative of what mental health care means to them today. Each person here was chosen to be photographed as a sign of solidarity with those who have suffered in the past and with those who may be struggling with mental health trauma today. Oops. Art can help us think much more deeply and in more nuanced ways about people, their health, their stories, their safety and their liberty. Most regrettably, I witnessed a relative, whilst unkept under section, being put into a headlock and held face down on the floor of a seclusion unit, when they had not been violent or created any risk other than walking towards a locked door. As a result of this, I tried to effect positive change, letters and emails to medical directors and consultants that got lost in the system that went unheard, a formal complaint with support from an advocate. I even took on a role as a peer supporter with mental health research. But the thing that has ultimately made a difference to other people's understanding was the creative work I made about this. I wrote a poem and created a prescription for the NHS with it during their 70th birthday celebrations. It's a long poem, so I won't share it all here now, but I did share it fully with the Trust's head of safeguarding when he came to interview me 6 months later about what was effectively assault on my relative. I'm pleased to say that that member of staff was dismissed from the Trust, but I'll just read the first 2 stanzas that became an introduction to the incident. Seclusion. The blue plastic vinyl rippled with sweat, reflecting the light of the fluorescent strip light bulb, which glimmered through the banal mediocrity of zero colour and nothingness. There was an odour of urine, but then there would be. The toilet was just inches away from the bed. Where do you put your head, I wondered? 3 feet away from the loo or 5? It must have been a difficult choice. And it was that line about the toilet that got to him. The Trust were in the process of designing a new unit, and he informed me he'd ensured they'd changed the design because of my words. Thankfully, that is the power of the arts. I was tired of hearing excuses for poorly run services with uncaring staff, so I made some postcards showcasing some free resources for the NHS. I believe art can give voice, explore and expose, heal and repair. Art can help us tell our stories in valid and valued and authentic ways. It can give us ownership of complex stories without having to constantly revisit traumatic life events. We can allow the impact of the work to reach out to others in ways we just wouldn't have the energy to. And I'd like to finish with a very short film I made of a sculpture, which I think describes the merry-go-round of care many people with long-term mental health conditions experience when they have become sectioned, hospitalised, and subsequently released. Each egg inside the container represents a very special and fragile life and is adorned by a photograph representing a patient. The artwork explores the tension and the anxiety many families feel about whether their loved ones will actually come out of the system, crushed by its failings, or whole, still fragile, but ready to continue their journey. Above all else, art goes beyond our very limited choice of words to find new ways to portray our experiences. I hope that in a way, the art speaks to the heart of the matter, and by so doing, attempts to make a very real difference. Thank you.
Thank you, Sue, for that very powerful presentation and video. That's next. Yeah, something given me plenty to think about. And I'm sure it has for most of the viewers and panelists too. Our next speaker is Sandra Griffiths, who's the founder and director of the Red Earth Collective. Sandra.
Hello, everyone. Hello, everyone. Thank you so much to my presenters earlier. So I am a director of Catalyst for Change, which is the West Midlands African Caribbean Mental Health Hub. And I'm also the director of the Red Earth Collective, which uses the arts to stimulate conversations about mental health and well-being, particularly focused on African and Caribbean communities, but other communities that experience racism and that are marginalised. And we're funded by the Wellbeing Foundation, so big up David, Wellbeing Foundation, as well as the Arts Council. And I've been working in the mental health field for the last 30 years or so. And I guess I want to share very briefly some of the ways in which I've used the arts in my work and some of my reflections about the power of the arts, particularly around achieving change as well as a tool for recovery, particularly for African Caribbean people with mental health problems. So I guess there are kind of three ways in which I've used the arts in my work. One way of using the arts has been just raising awareness of the inequalities that communities, particularly African Caribbean communities, face with their mental health. And one of the ways we've done that is by producing a art and mental health festival called Stereotype, which brings together artists, many of whom have got a lived experience, and the community, staff from the NHS and the voluntary sector in a space, the same space, reflecting on what are the factors that shape the mental health and well-being of the community, and how can the risk factors be addressed and challenged. And we've been running that for 14 years. I started it actually when I was working in East London at the NHS, and I ran the MENA programme. So I do remember you, Baroness Meacher, because I think you were chair at the time. And so the journey of using the arts as a tool for raising awareness around what are the factors that shape the mental health and wellbeing of the Black community, kind of its journey started there when I was in the NHS. The other way in which we've used the arts in the work has been as a training tool. And we've used drama principally as a way of bringing together staff and service users, for staff to hear the impact of their practice on service users and patients, and for more increasingly for service users to hear some of the challenges that staff encounter in their work. And so there have been two drama productions that stand out for me as a tool for having a conversation between staff and service users. So 300 Voices, which is actually a programme that I was involved with when I was working for Time to Change, which used a play to kickstart a conversation with a range of stakeholders to look at how can we improve the relationship between young Black men and the services they come into contact with. And the other drama tool, again, was something that we produced when I was at Mellow in East London, which was based on the voices of 32 Black men with mental health problems who shared their experiences of being patients and service users of the Mental Health Trust. And based on their stories, we created a play which was then performed to staff across the Trust. And that was in 2005 when we had Delivering Race Equality. Some of you who are as old as I am may remember that. And that enabled quite a challenging at times, but I think quite an enlightening conversation between staff and staff from, you know, across the spectrum, from psychiatrists, healthcare assistants, and everyone in between were invited to come along to see this play, to hear and to see and feel what it was like for Black service users to be receiving services from the Trust. And there were some incredible conversations and challenging conversations as staff watched that. And thirdly, the way in which we've used the arts is as a tool for recovery, and offering a range of different participatory art forms to enable Black service users to explore their experiences, but also to restore their sense of purpose and their sense of identity, and challenging that their identity isn't just an identity around their mental health problem, but they have other identities too. So our art-based workshops were a space that allowed service users to explore, to express themselves without censor, but also as a way of exploring their other identities, including their identity as an artist. Because many of the people that we were working with were artists before they became unwell, and were able to reconnect with that. So I've been plugging away over the last 30 years about how to use the arts to kind of improve the mental health and well-being of principally Black communities, but not exclusively. And I'm a real advocate of a couple of, the theme around art is not just a nice add-on. Yeah, it's not something you do when Black History Month comes around or World Mental Health Day comes around. Yeah, it's 24/7, it's 365 days of the year, but it's a way in which you, and I think this came from the foreword in the 2017 Creative Health, the Arts for Health and Wellbeing report, which talks about how the arts can humanize the system. that can allow both staff and service users to see each other's humanity. Yeah, they can see us. Yeah. So for me, the arts isn't just about enjoying and expressing. It's about expressing yourself without censor, and it can give sheer pleasure. You know, when I think about my mom who's got dementia, when she sings along to the Cliff Richard song during her dementia singing group, apart from the fact that she's the only one who does that, but it gives us such sheer pleasure participating in an art form, and it helps her to forget some of the real challenges that she's living with, having dementia. But I reflect on the 4 principles of the Mental Health Act, and I'm reminded of kind of some of the narrative therapeutic practices that I've become more interested in over the last couple of years. And it seems to me that there are some opportunities through the arts that kind of chime with a narrative therapeutic approach that I think pose some interesting opportunities for us. And one of them is about how the arts can, which is described by a colleague called Nzela Nukube, who uses a narrative practice called Tree of Life. She talks about a riverbank position, which creates a safer territory to stand on before talking about difficult issues. And I've found that the arts has enabled difficult conversations to take place, particularly some of the conversations that we've had around race and mental health. And I really like that. It's a riverbank position that creates safer territories to stand on before talking about difficult conversations. I mean, certainly with the drama production that we did at the Trust, the Foresight drama, it allowed that. The other way in which I think the arts can really help with challenging race inequalities and also speak to services seeing people with a lived experience as an individual, it allows people to tell the stories on their terms. Yeah. And I say stories, so we're not just one single story. And for me, that the way in which we've used the arts to enable patients to tell their stories has allowed staff to see beyond their illness, to see them as multiple identities, people with multiple identities and multiple experiences, and to challenge some of the myths around Black young men are like this, and to open up the conversations about the Black mental health experience is not just about young Black men, because often research tends to focus on that group. I think the arts also enables a kind of sense of restoring a sense of agency and control. And it increases, which links to the enables people to tell this, multiple stories about themselves. It increases a wider context of understanding people's lives. And lastly, but not least, it kind of challenges and disrupts current thinking and approaches. It allows for that, creates space for that. I think there's some great potential with some of the principles that are outlined in the Mental Health Act reform. But it seems to me that without some of the building blocks of engagement and knowledge exchange that can be achieved through the arts, the reform could be very painful and very slow. And I think we should engage in the power of the arts to enable engagement about often difficult things, but how you can create systems change. And that we can challenge people to emerge from their silos and discover shared territory and maybe different territory, but join forces to create the reform that will enable people with mental health problems to get the right care at the right time and in the right place.
Well, thank you, Sandra, and particularly thank you for bringing up the area in terms of people from a Black minority ethnic background, which I think, as many people know, the disparity, the overrepresentation of people from a Black minority ethnic background who are subject to the provisions of the Mental Health Act was one of the founding drivers behind the review and thoughts for the reforms going forwards. I have to say, I mean, I never thought of using the arts in terms of educating health professionals as well, in terms of, in that sort of more formal sense. And that was very interesting for me to hear in terms of those workshops that you were doing, sort of not just in all different ways, art and creativity can be implied and be used in, for the entire system as a whole. So very much appreciated. You're talking, I'm sure there'll be lots more questions. There'll be lots of questions from the audience. We once we get to the end of the speaker bit. Dr. Rashid Mooney, who's from the University of Oxford, who's also doing a lot of work with Professor Karandeep Buri, who I know would have liked to have been here but wasn't able to in the end as well. But it's great having you here, Dr. Rashid. Take it away.
Thank you very much. I've just got some slides that I'll share as well. There you go, hopefully you can all see those. And actually your comments regarding Sandra's work actually tie in quite nicely with this. So thank you for inviting me to speak to you all today. My name's Rasheen and I'm a co-PI alongside Professor Kambui on a project that uses creative methodology and seeks to improve the experiences of those detained under the Mental Health Act. This project, fondly known as COPACT, was funded in response to a themed call that was put out by the Policy Research Programme within the National Institute for Health Research. So we do hope that this will feed into the discussion surrounding the reform of the Mental Health Act. And as Ben was just saying, we know that people from minority ethnic backgrounds are detained under the Mental Health Act at a higher frequency than their white British counterparts. There are many ideas as to why this discrepancy exists, such as discrimination, stigma, comorbidities, multiple disadvantage, and illness-related disability. These explanations are all compounded by a structural disadvantage in society that results in a greater risk of developing mental illness for racialised populations, combined with more challenges in accessing and engaging in help. However, in reality, a single narrative explanation reflects a lack of understanding of the complexity of the problem and how these issues may all actually interact with each other. Our project looks to adopt a creative systems approach to develop a novel way of foregrounding service user narratives in the co-design of a local approach to reduce ethnic inequalities in the implementation of the Mental Health Act. We want to acknowledge that this is a complex issue with no one-size-fits-all solution, and to empower those with experience of being detained to own and share their experiences in a different way and contribute to policy. This is a very ambitious research programme that's going to be conducted over 25 months. To start, we will conduct photo voice workshops in 7 cities, each with 20 people who have been detained at least once under the Mental Health Act in the previous 12 months. We anticipate that at least half of these people will have more than one detention experience, and we will aim to recruit a population that represents those who are often overrepresented in local detention rates. In parallel, we will also conduct a national workshop with professionals who have experience of detaining people under the Mental Health Act. And pending approvals, we're hoping to start recruiting for these workshops in July. The outputs from these photo voice workshops will then be presented at a series of co-design workshops that we will convene in each of the 7 cities we're working in. These workshops will be comprised of a number of different key stakeholders, including service users, carers, psychiatrists, mental health nurses, commissioners, voluntary organisations, and police representatives. The aim of these workshops will be to develop a local approach to reduce ethnic inequalities in the implementation of the Mental Health Act. And at the end of this process, we'll convene a national knowledge exchange workshop, which will allow all the different 7 sites to meet and share their experiences and the approaches that they've developed. And this will really help us to begin to think about what works, where, for whom, and how. At all of these workshops, we'll seek feedback from the participants, and during the co-design process, we will also consider the cost implications of any of the proposed approaches. So whenever I talk about this project to other people, I always get asked to talk more about photo voice and the kinds of images that we anticipate participants will take. So I just wanted to take a moment to share these images that were taken as part of a public engagement project with people who had experience of psychosis that was conducted by the Synergy Collaborative Centre. In our photo voice research, we will host 3 workshops. The first workshop will introduce participants to the concept of photo voice and photo ethics, and then provide them with any necessary materials to go and take photographs. In our previous work, we found a preference for disposable cameras, but we will facilitate people who prefer to use smartphones or their own digital cameras. The second workshop will be held 2 or 3 weeks after the first. And here we will help people to choose which photos they want to focus on, and we'll take participants through a guided reflection to enable them to explore and caption their images. In the third workshop, participants will have the opportunity to share their experiences with other members of the group. Photo voice has been found to be a very empowering tool that really helps people explore their experiences in a very creative way that isn't bound by language. And we're hoping in the future to also further develop photo voice as a policy research tool. And finally, I'd just like to acknowledge our wonderful team that have come together to make this research possible, and to really emphasise that experts by experience are integral to the success of this project. So to that end, we have an expert by experience, Doreen Joseph, as a co-applicant, who we have also formally employed at Oxford University. Our advisory board is co-chaired by an expert by experience, Colin King, and we're in the process of forming a PPI group that will be co-chaired by Doreen Joseph and Sandra Griffiths, who spoke just before me. So thank you very much for listening, and I'd welcome any questions.
Thanks, Dr. Shun. If people want to find out more about the project or maybe even take part in it, what's the best way of them getting in contact for you or finding out the details? Where should they go to?
In the first instance, probably best to just email me. I think my email was on the first slide, but I can also, so I'm just trying to stop sharing my screen. I can also ask that to be sent round as well.
Okay.
But we're in the process of getting kind of ethical permissions and stuff at the moment. So we're hoping to be able to advertise a bit more broadly towards the middle of summer.
Great, because it's just in case there's people on the who are watching the webinar who are thinking actually it'd be great if we could do some research in a local patch and collaborate. So contact you directly, first point of contact, Yeah,
we're really keen to collaborate with other people.
Thank you very much. Great. Next, Stephen Stanford, the Trust Lead for Allied Health Professionals, East London NHS Foundation Trust. Stephen.
Thank you, Ben. Thank you, everyone, for this opportunity to speak today. I'm going to show a short video just to start off with. It's 3.5 minutes, and it reflects our commitment to creativity at East London NHS Foundation Trust. I'll have a go at doing that myself, Alex, okay? Thanks.
But I want to start off by telling you what the philanthropist means to me personally in my everyday work.
At Elft, creativity can be the way to have a meaningful conversation, the way that we say what we really care about.
At ELFT, creativity is helping us to generate new insights into how to improve the health of the populations that we serve.
QI is improvement. You and I, yeah, we form up a team. Add him and her, plus he and she equals bringing ideas into being. Trust. You can feel the movement from Hackney to Newham to Hamlet to Luton. Trust. To Bedfordshire, another question, sir, is what are we doing?
My favourite word for creativity is play, because we all play, but it kind of gets lost. And the idea of arts therapies is we're giving people a chance to play again, to express themselves.
Everything we do, yeah, we're doing it with patience. Everything we do, yeah, we're doing it for patience. Listen and we learn, make changes and grow. As we make the change, trust the changes will show. Set the targets, work hard to achieve the results you might find hard to believe. Perspective sharp, objective smart. One eye and QI, work hard for the team. Yeah, harm we're reducing. We're quality improving. Tell them what we're doing. We're quality improving. We care, we respect, we're inclusive. We're quality improving. Anytime, any place, what we doing. We're quality improving.
benefits for any of these therapies, really, whether it's music or art therapy or whatever. I think it's a good thing for people to do.
Just to add to that, if I just share my screen again. It's my job to support around 800 allied health professionals at ELFT. And within that workforce, I'm really pleased and privileged that we have 60 arts therapists. That's right, 60. Out of the 6,500 employees that we have at ELFT, those 60 arts therapists add so much to our workforce, and they continually punch above their weight. They bring creativity and they help us with our ELFT promise to work creatively, to learn what matters to everyone, to achieve a better quality of life, to continually improve our services. And so through art therapy, music therapy, drama therapy, and dance movement psychotherapy, we have a workforce that in previous lives before they became registered clinicians were all musicians, artists, dramatists, and dancers. What we've used those staff to do is unleash the creativity across our workforce and ensure that the arts don't remain within the preserve of just those people who are committed to the arts. So Dan, if you were a consultant psychiatrist at ELFT, it would be your job to bring to work your singing voice, to bring to work the reality that you love movement potentially, or like our chief executive did at International Nurses Day last week, share a poem as a way of inspiring and celebrating the work of our nurses. These are the top tips from ELFT to really make the NHS organisations a creative workforce and a creative space. Think organisational creativity and think system-wide in your creativity. Unleash the power and the creativity of your senior leaders. Encourage everyone to bring all of themselves to work. Harness the energy and talents of service and staff and service users, to co-produce what matters to them. Think about personalised care and choice. The reason we have so many arts therapists at East London NHS Trust is because we know one size does not fit all. Build bridges with your arts and culture partnerships. Bring in artists, bring in arts organisations to help you on your way. Finally, make it fun, stimulating, challenging, and reflective. The NHS currently is going through a massive recruitment and retention challenge. I think there's space right now for a renaissance in workforce planning that brings more creative colleagues into the NHS and uses their skills as essential. Finally, we know now that the gap between service user and staff member in the NHS has closed significantly through the impact of the pandemic. We as NHS staff reflect much more carefully now the needs of our service users, because we have all been service users ourselves. Let's work together and think about creativity, and let's think about what helps to really keep us alive. Thank you.
Thank you, Stephen. I think the thing that absolutely sticks out for me in that talk is the QI rap, which, as I'm sure probably people saw me laughing all the way through it. What a brilliant.
With our rapper, our chief pharmacist, Vondi, who would have thought? Thank you.
I just think that's it, on so many ways, the quality improvement rap is just a work of pure genius. And I wish it the best in terms of the Christmas #1 this year, going forwards. If it is released, because it should be, that is absolutely brilliant. Clancy Williams is our next speaker, who's the director of Angels Without Wings.
Thank you very much. I'm just going to go to sharing my screen. Sorry. Okay. Everybody see that?
Yeah.
Okay, thank you. I've just been absolutely bowled over by all the presentations that have already gone before me, and lots of what I want to share today in part has actually already been shared, but just to thank you for allowing me to come and present something about the work that we are doing in Birmingham in conjunction with the Birmingham CCG. And I presented this first slide in terms of the Sankofa bird, who is a West African mythical creature that what she does, you can see that she's got an egg on her back and she reaches to the back in order to inform, in order to take the best of the past into the future to affect change. And as I was thinking of preparing for this particular presentation, there was a number of things that kind of really jumped out for me in this, as we are considering how culture and creativity can support changes in the Mental Health Act, and then the four principles that are being considered. And so the two that I'm going to be really kind of reflecting on are the latter two, the therapeutic benefit and the person as an individual, because I think historically, particularly for people from African and African Caribbean communities, which is the focus of the healing circles which we run in Birmingham, that person-centeredness around that individual has often been lacking. So when we're looking historically in relation to historically in relation to mental health, I thought it was really important for us to really kind of get a sense of what was informing the Mental Health Act in the beginning, and in part how we've arrived with what we've historically have and what we potentially could have moving forward into the future. And so I think when we think about psychiatry, and Ben, I know that that's your area of expertise, when we think about psychiatry, psychology and psychotherapy, there has been sadly a lack of, I guess, compassion, I would say, in relation to how people from African and African Caribbean communities have been viewed. And there's a plethora of information out there as to why that is. But if those theories start from a deficit model in terms of seeing people as human, then we have the starting of policies, procedures, ways of being, practices, and a service provision that starts from that viewpoint as well. So what I was asked to consider was to think about how is it truly possible to have a sense of being well when an individual is overrepresented in so many areas, where services don't necessarily meet their specific need, and what the impact of them living within those systems has on their daily mental health, even before they get to the place where they are being sectioned and put into institutions. And so, and it would be nice to think that we were thinking about stuff that was historical, but we only have to look at what is happening with our footballers of late from minority ethnic communities in order for us to see that we're not actually dealing with an issue that's historical. We're dealing with issues that are present and that are very now. So one of the reasons why we began to think about how are we going to put together a service provision that speaks to the culture of communities from the African and Caribbean communities was to think about how we reshape and redefine when we talk about arts, culture, and creativity. Whose arts are we talking about? Whose creativity are we talking about? And whose culture are we talking about when we are forming together the policies, procedures, and practices and in order to support those communities? I wanted to kind of also pick up on a statement that is it Lorna or Linda? Sorry, I can't see everybody on the screen. That Lorna shared, that she said one of the clinicians said, "I see you," and it was reminded me of one of the slides that we work on in the healing circles of a Kiswahili term called sawabona, which very much goes beyond that notion of "I see you" to "we see you," and that's very much the frame that we want to work with on the healing circles. So I'm just going to skip past a couple of a slide here. As a theatre practitioner and a lover of theatre, I was reminded of a statement by Antonin Otado, who's a famous theatre practitioner, who states that life mirrors theatre and theatre mirrors life. And so therefore, if we are going to have this mirroring, then the principles need to kind of reflect that in its statement around culture, its statement around arts, and its statement in relation to creativity. So we have currently now 5 healing circles that we run in the West Midlands, and they're all based on the principle on African-centered historical principles, practices relating to arts and culture and creativity. And I'm just going to quickly skip through because we have healing circles that represent mature women. We have healing circles specifically for frontline workers who are struggling with their own mental health. And we know that that has been spoken about in the media in relation to the disproportionate number of people that have been experiencing the impact of COVID-19. And we've also launched our recent men's healing circle, which absolutely has taken off in ways that we could not have imagined because the need is actually there. So the healing circles run at the various times. They're for an hour and a half, and they kind of look at the, we approach the healing circles from a strength-based model, that we don't focus primarily on the things that are wrong with an individual, as opposed to holding and bearing in mind the systems that actually aid the discomfort and dis-ease that people often experience. And so whilst they are not therapy sessions, they are very much therapeutic in their nature. And what we've been able to do is to really hone in on some of the areas that people have brought to the healing circles that they actually want to begin to discuss. And we utilize breathing techniques, we utilize self-soothing techniques as well. But we're actually drawing upon all of those experiences from a cultural base. And people have talked about the importance of art. We've talked about the importance of drumming and drawing and painting and music and dance, and all of this we've been doing virtually online, which comes with its challenges. But we started off with a six months program, and that has been recently extended to 12 months now. And so we know the challenges of funding and getting your program approved and looked at, but the CCGs in Birmingham are quite keen to trial this for a year. And the aim for us at particularly Palliative Therapy Services, which is the organisation that hosts the healing circles, is that the healing circles will become part of the health by prescription service, and that it is as accessible to people from African and African Caribbean communities as the smoking cessation and support that goes out for different areas. So we're very much about trying to capture people before they have to enter the third tier of mental health provision. But also we have had the opportunity to consider bringing the healing circles into secure units so that we can see the impact of how that might work as well. Okay, I'll just stop sharing my screen for a moment. Thank you.
Thank you, Candice, and thank you so much for bringing it. I think it's great that we sort of finished off on your talk, because you really root it back into the community and seeing things all in the round, which I think was just a good summary of reflection in terms of just all the different facets which we've been talking about here today. Before I invite Baroness Ruth Lister and Molly Meacher to give a response, I just wanted to thank all the speakers who've taken part in today for such a brilliant range of talks. We've gone from people who've had direct first-hand experience of being in hospital and how arts helped them, to people who are doing cutting-edge research in the area, to people who are dealing with this on the ground, both in terms of on the statutory sector, so working in NHS, and people working outside NHS, all bringing things together. I think it's been such, for me, it's really opened my eyes in terms of just the different ways, exciting ways that arts, creativity and culture can be used or deployed. And just really inspiring the amazing work that people are doing, and particularly the passion that people have in terms of driving change and improvement. Now, I can't rap, but I could do, I sort of feel like, there should be a sort of art creativity rap in terms of the improvements that people are trying to drive forwards. And I'm really confident in terms of where we can get to driving forward change as part of the Mental Health Act review. Baroness Ruth Lister, would you like to come in and give your thoughts? And then I'll bring in Baroness Molly Meacher.
Okay, thank you very much. And thank you to all the panel for a really powerful and inspiring set of presentations. And I feel totally ill-equipped to respond because I have no expertise whatsoever in mental health, unlike Baroness Meacher, who has plenty. But I do have a particular concern, which I think is relevant to what perhaps what all of you have said, and that is the position of people experiencing poverty, who are a very large marginalised group. And clearly there is some overlap with Black and minority ethnic communities because their risk of poverty is greater than that of the rest of the population. But the depression and psychic distress we know are all too common among people experiencing poverty. Partly the sheer stress of trying to get by on an inadequate income, and the insecurity associated with that when you just don't know what's going to happen the next day in terms of unexpected demands on your income or whatever. And this links to, I think, what, I can't remember who, I think it was Sandra said about agency, which is so important. And sometimes we forget that people in poverty have agency and they exercise agency, but it can be severely constrained. And there's a sense of powerlessness, a sense of lack of control. And thirdly, I think the impact, the psychological impact of how people experiencing poverty are all too often treated, what I in my academic work have called othering. And it can involve shame, disrespect, and even dehumanization, which again is very relevant to some of the things that have been said today. And we know from the Office of National Statistics that people on low incomes have suffered more in terms of their mental well-being during the pandemic than have better off people. And so I think the issue, the problems are that much greater now. And the APPG report that, I can't remember who, I think again Sandra referred to, gave some very good examples of arts projects that have supported and helped people in marginalised groups, including people experiencing poverty. And when I read that report, it reminded me of a newsletter from the European Network on Action on Poverty some years ago, which made the point that access to culture is a basic human right, which is a point that David made right at the outset. And it was brought home very well by an expert by experience with whom ATD Fourth World, which is an anti-poverty human rights organisation, worked. And she said, even though I live in an area which isn't beautiful, I can still appreciate and create beauty. I can, the right to beauty is part of my right to dignity. And I think that idea of the right to dignity is underpinned so much of what you have all said today. And I hope that when we pay attention to the needs of marginalised groups, we remember those who are marginalised purely because they have insufficient incomes. And I'll leave it at that.
Thank you, Baroness Lister. That very thoughtful response in terms of what we've heard today around the threat of dehumanisation, which I think is very, very sensitive to all on the call. Baroness Bonamici.
Well, I ought to keep my comments very brief because we need to get on to the Q&A. But can I just say a big thank you to the speakers today. It was very moving for me, actually, having been chair of Mental Health Trust at a time when we were creating the commitment to arts and culture. And in fact, it went broader than that. We had tremendous football teams, which were hugely popular amongst detained young men who found that they weren't just a schizophrenic and a schizophrenic, quite unresponsive to treatment. Some they found, actually, no, I'm a footballer. And I sort of remember watching them realizing that they could actually deal with these voices and terrible things that were happening to them because they sort of could push them on one side of it while they played football or whatever it was they were doing. We had all sorts of sports at the time. So very, very powerful for me to hear the speakers' comments. And I just want to mention a few because they're so right. Arts and these arts and culture enable people to communicate who are finding it extremely difficult to communicate. It enables people to have this identity. I'm an artist, I'm a footballer, I'm a member of a band, rather than I'm a schizophrenic, I'm a depressive, whatever. So the identity issue, I think, is huge, actually, very, very important for people. It enables people to express their feelings when actually they're incredibly blocked at that time. Very, very important, helps people to think, and art heals. I think these are wonderful, utterly true expressions about what this agenda is all about. I only want to say it was thrilling to hear Stephen Sandford. You've gone such a long way forward from where we were when I feel we sort of started all this. But my commitment now is to try and somehow or another use the mental health review and the new bill to spread this across the country, because and tell me, Stephen, if I'm wrong, my fear is that this has not moved across the country as I would have wished by now. We want every trust to have 60 therapists, as we, and I call it we, have in East London. These arts and culture, and I would add sport, initiatives should be universal across the country. So I don't know, Stephen or others can maybe help me how we get this into the bill when it finally arrives, but that's my commitment. Thank you.
Thank you. Very important point to bring sport as well as part of it. I think with all that's so crucial in all this. Right, well, on to questions now. There's one question which the first one that I've received is regarding it, now that the consultation's closed, what's the plan going forward? How can we, I think it's, can we still respond? So as in the Queen's speech last week, there was a commitment to bring forward proposals with regarding the reforms to the Mental Health Act. In previous conversations I've had with ministers and civil service, the plan was to have quite a long consultation period to make sure that we get this right in terms of it, and that the reforms to be the best they possibly can be, because this is such a huge area. So even though the consultation's formally closed, I hope that there will certainly be more opportunity to have consultations either informally as an event like this, or I think more formally. And I would suggest to people, although I probably won't get any thank yous for it from the powers to be, if you haven't responded to the consultation, do respond anyway. And I'm also very happy, although I'm a backbench MP, this is very close to my heart. And so if people do have strong views or thoughts about things, how things need to be going forwards, please do write into me. As well for me to have that. So I very welcome people's thoughts on it going forwards. But hopefully there will be more opportunity for more consultation as part of the implementation of the review. My second question, right, give me a second. Okay, so the importance of the arts in mental health work treatment seems very convincing. Turning to the law and the Mental Health Act itself, do the panelists think there are any pieces of statute law which could be usefully written into the new Mental Health Act, rather than, say, recommendations to the NHS and bodies providing treatment? That's a brilliant question. So what is it in terms of the law going forwards? Do you think that we could give some statutory teeth to what we've been talking about today? Or is what we're talking about something that is going to have to sit within guidance, codes of practice, things like that? Do we have any, just wave at me if you've got any takers in terms of answering that question.
Can I just,
Go for it.
Can I just say, I think if we really want this to spread across the country, then it's got somehow, something has to be in the law. Guidance is fine, but it's not going to change things. And this is so important because it actually does make such a huge difference to people, particularly people detained, but actually everybody involved in mental health services. I have to say, not having seen the bill, I haven't seen exactly how we can do this, but we can somehow put something on the face of the bill about, every trust must have a responsibility to, to develop arts and culture and sport initiatives. Something which will enable those who are committed to this agenda, this really important agenda, actually to pick it up and run with it. So that's what I would hope to do, but we'll see. Or the whole, that Parliament and everybody else will try and do.
Thank you. And what's, although we haven't got a draft bill, what's interesting is that there is a proposal to have these statutory principles like the Mental Capacity Act, which I think would be a huge step forward and does give that window of opportunity to sort of unpick a bit what the act is all about. Sue, you wanted to come in, and then Stephen.
Yeah, it was just looking at the principles. I think the arts and the choice and autonomy of individuals. If something could, I'm not a legal expert, but if something could be embedded around the choice and autonomy of service users that link to the arts, because it's that some of the practices are so restrictive and so medicalized that sometimes the human element really gets lost, and that's why the arts is so important. It's from our experience, I was kind of, this isn't rocket science. This is about compassion and about communication, And I think the communication element, sometimes when people are in very complex situations, those things get missed out. But it's yeah, so I think something around that choice and autonomy would be very useful.
Thank you. Stephen.
Thank you. I think as someone who's sort of waiting for the Care Quality Commission to knock on our door again, subsequent to COVID, to assess our inpatient facilities here at Elft, there's something about the richness of the therapeutic experience that service users have when they're detained on a mental health ward. And I think coming back to quality improvement, Ben, you know, the variation of access there is for service users who are at that most vulnerable and distressed state through no fault of their own, to a holistic assessment that really draws together a perspective on who they are in their entirety as a whole person, as opposed to just a focus on a biomedical assessment around their capacity, really interests me. And I think that's a comment on workforce planning again for the NHS, and thinking about actually how do wards function with the staff skill mix that reflects its ability to connect with the nuance of individual experience. So I think there's something about ward experience and its richness that really, I think, is very important.
Thank you. Let me just see if we've got any more questions. I've got a question list at the top, which I can go through. So I'm just looking at the different Zooms. Are we going to discuss the Coronavirus Act and how this has affected sectioning, etc.? Now, of course, the provisions in the Coronavirus Act to change the criteria of detention were never brought into force. So there's no change there. But does anyone have any comments, I think? I mean, that's a fair point. We haven't spoken about COVID at all during this seminar, which is brilliant in a sense, because I think perhaps we're all going to get a bit tired of endless conversations about COVID, but it's still nevertheless a good thing. Does anyone have any comments about the impact of COVID? Yeah, go for it, Dr. Rasheen.
It was just to add that in our research, we are going to be looking at people who've been detained over the last 12 months. So although we think that a lot of those people will have more than one detention, some of those people will have been detained during the pandemic as well. So we are keen to explore those experiences and how coronavirus have had an impact on that too. So I don't have the answer yet, but it is something we're hoping to look into in the course of our research.
Good stuff. Anyone else got any comments on COVID, or should I go to the next? So I guess I was a bit naughty as chair, because I sort of implied that trying to steer away from a COVID conversation. So don't let that inhibit you if you feel I want to mention impact of COVID, or we can spare our viewers from it. Right, next one then. I read in one of the Bearing Foundation reports that your organisations, this is for Sandra, provides training to artists to enable them to work in mental health settings. Where can I find out more about this training, please? Do you offer this training to organisations investigating for dance organisation and associated dance artists? And if you don't mind, I might open this up a bit, because one of the things that come out as a theme is that lots of people are doing such amazing pockets of work, and just one of the things I always wonder is how we can share that expertise and, you know, help everyone start, you know, make improvements going locally. So so for Sandra specifically, but I think generally, we can send around to everyone, I hope we can, links to all the work that people are doing if they send them through. But just, do people have any advice in terms of where they can go to find out how to get involved, or how to do some of the work people are doing locally? Sandra? You're on mute, Sandra.
Okay, am I unmuted now? Yeah, obviously I'm happy to share, you know, the work that we do, and people can contact us through our website, and I can put my email in the chat. But I also just think, as you say, more widely, there is a challenge about how artists or how practitioners can find out locally about training or opportunities. And I think that through the work of the Bearing Foundation, there was a directory that's been produced, there's a Culture, Health and Wellbeing Alliance, there are forums, and maybe you know, I do think that there's more work that we can do to kind of communicate to people more locally what opportunities there are, but maybe through some of the mental health trusts work, and a number of community NHS trusts have community engagement teams and staff that are more, you know, sort of engaging with the community, that, you know, there's work that we can do to kind of make people aware of what's happening. But I do think there are a couple of resources that perhaps through this sort of seminar we can be sharing with people. But there's more work to be done, I think, about, you know, so that people know that there's kind of a place where people can kind of get information and training and support and resources.
I was going to ask the Hearing Voices work that is that available online for people to see some of the drama pieces of work, or is that very much kept internally because of sensitivities and etc.?
Okay, well, there's the Foresight drama that we did, which is in 2005. There is a report that we can share, the evaluation, which is actually done by Sainsbury's Centre for Mental Health, which you know, we're saying, I'm not sure what it's called now. What's it called now? The Centre for Mental Health. So there is an evaluation. We didn't actually film it. And the 300 Voices, there is a toolkit that, and I think that there's a snippet of the play that's, you can get that on the National Mind website that now hosts the work of Time to Change. But definitely can share the evaluation feedback. And, you know, we have been thinking more recently about kind of how might we get resources to kind of produce the script and have conversations with others who might be interested in kind of performing the piece.
Thank you. Does anyone want to come in? Yeah, Sue, go for it.
I just wanted to say that I think David mentioned earlier that our sector is really quite fragmented and quite small. A lot of us have got limited resources. So within a local context, I think a lot of arts and health organisations do their very best to have an impact on the people that are coming forwards that want to get involved in this work in a meaningful way. But until it's kind of levelled up with service provision, if everyone was like East London Foundation Trust, it would be a lot easier to make those kind of connections. So it can be quite sporadic in terms of who you're working with and how you make that impact. I think that there is a real need for investing in the sector so we can train the sector and we can inform the future of healthcare delivery in a better way, really.
Thank you. I'll bring you in a second, Stephen. Clancy, then Stephen, and I think David, did you want to come in as well?
I just wanted to kind of add to what Sue was saying, because there's also something about competition and the way that funding is set up and how people access funding and the longevity of particular pieces of work. So historically, you know, funding rounds go for 3 years, 2, 3 years, 5 years. Well, you know, it can take you that amount of time to set your systems up, and it's how does government enable organisations to be able to focus on the work that they do without this threat of finances being pulled in the next 2 or 3 years, and then you lose quality staff because they equally have to have, you know, they've got their own lives and things that they want to do. So I totally agree with Sue that there are often lots of organisations in areas doing really excellent pieces of work, but until this risk of the threat of competition and finances is actually dealt with in a more holistic way that actually meets the needs of the service users as well as the organisation, then, you know, sometimes you get in contact with an organisation or you get recommended to speak to an organisation only to find that they no longer exist because the funding wasn't continued. And yes, I know that we have complex financial challenges, but I do think this issue around funding is actually historical and not something that's new, that really needs to be looked at.
Thank you. Stephen, you want to...
Our time is nearly up, but I just wanted to reference as well my concerns around the proposed changes to arts education funding as well. And I think there's a direct correlation with what we're talking about today, with just how we inspire our young people to engage in the arts, and also then carry the arts as tools for change, agents for change. My last slide of the Mona Lisa receiving her vaccination was deliberate. You know, the vaccination will keep us alive, but it's the arts that will keep us living, and I think we owe that to the next generations coming through as well.
So my laptop was just telling me it's going to turn off the power, so I was just double checking it's actually plugged in. So apologies for the pause there. We've got a few minutes left. What I'm going to say is, before I sort of wrap up and just thank everyone for attending, does anyone else want to make any other comments in terms of some of the questions that we've had just before we wrap up based on this discussion? I think it's been a lot of, for me, what's really come out of the discussion is how we just share expertise and we sustain expertise for the long haul. And I think that's such, I have to say, such a broader question than I think that's a perennial problem in terms of the NHS as a whole and its interaction with various different services. So, but one that does need to be resolved, particularly as we go forward and beyond COVID and the impact that's had. I hope we can crack it in terms of sorting arts, health and creativity going forwards. But if anyone want to put their hand up and do a final comment, or we all go? No? Cool. Okay. Well, on that note, look, I mean, it's been a brilliant discussion. I'm just, I think it's been fantastic hearing just all the different range of views and experience from all our speakers. I'm thankful to everyone who's contributed today. Thank you to Ruth and Molly for taking part in giving our response. And a particular thanks to Alex and Arts and Health Southwest for organising the event and supporting us, which I think has been hugely worthwhile. Now we need to translate talk into action. That's exactly, we do a lot of talking. I dare say politicians do a damn lot of talking. As a psychiatrist, I did a lot of listening. But we need to drive forward, and I think have careful thought as to what's the best vehicle in terms of getting the changes and sustaining that going forward for all the people we're involved and look after and care for. So I hope this is the start and continuation of this conversation. Look forward to, I'm sure, hearing and speaking from you again. And just thanks again to everyone and for everyone who's taken part and submitted some superb questions for us to chew over. Thanks and goodbye.
Thank you.
Thanks. Thanks, everyone. We'll just sit here and let people go. If anyone wants to stay for a brief chat, I'm going to switch off the recording now. Participants will leave.